Hello, my viewers. Hello, friends. You're welcome once again to my YouTube channel. I remain your humble friend, Obichukwu Daniel Anekwe is my name. You can call me Dr. ODA, Dr. Oda, Dr. Obi. I'm a medical doctor by profession. We are still on our discussion on certain health issues, the misconceptions, the misinterpretation of certain health issues. Like I always said, this is not medical lectures about medical topics or health topics, but just to guide our people, to give you professional medical advice on health issues so that you will be guided accordingly, so that you will not move away from the normal thing you're supposed to know and do as far as certain health issues are concerned. Today I'll be discussing on a topic I titled The Silent Killer, and I'm talking about hypertension or high blood pressure. Many of us has come across hypertension or high blood pressure. Many of us has heard about it, and so many people already has it. So today, what am I talking about? Hypertension, when the blood pressure is high. We say that somebody has hypertension, especially when the systolic blood pressure is more than 140 millimeter of mercury, and the diastolic is more than 90 millimeter of mercury. We say that somebody has high blood pressure. However, there are different classifications of high blood pressure: mild, moderate, severe, hypertension, and all that. But that's not what we are here to say. I'm here to talk about the misconception that I have seen, I have heard people talk about over many years of my practice, both around me, in social gathering, and in my clinic, how people misunderstood certain things about hypertension. What am I talking about? For instance, I have seen people diagnosed of hypertension, both by myself or in my clinic or where I work from or other places. And they will tell me, "Doctor, I don't want to be on the drug," or that I declined using the drug. Why? Because my friends say, my people used to say that once you start taking the drug, you take it for life. You take it for life. And that they said that the drug has side effect. It can cause weak erection, it can cause headache, it can cause cough, and all that and all that. Yeah, true. But I used to ask them, those that said this to you, did they tell you what will happen to you if you do not start taking this drug? And they will be looking at me. They will say no. I said, they would have told you. Now, since they have told you what will happen to you if you start taking the drug, they would have also tell you what will happen to you if you don't take the drug. They would have shown you both sides of the coin. That would have been fair enough, so that you make an informed opinion or judgment about the whole thing. You understand me? So they have told you that if you start taking the drug, you will never stop, you will take it for life, and that it has side effect. And I will always start by telling them that everything in this world has side effect, even the life you live. Even the food we eat, the water we eat, they all have side effects. But that's not the topic today. Now, I said to them, now, let me tell you what will happen if you don't take this drug, especially now that you have been, established or diagnosed that you have hypertension. And some of them even has positive family history of hypertension. Maybe in their mother, father, brother, sister, uncle, blood uncles, and aunts. You understand? That if you don't take it gradually, because it's called a silent killer, it will gradually be killing the organs in the body. And most of the time, the kidney will be first to go. The kidney will fail. That's why you see people today having kidney failure, kidney diseases, chronic kidney failure, and they will start doing dialysis. From dialysis, we talk about kidney transplant. And certainly, once it's dialysis and transplant, the person is counting his day to go from this Mother Earth. And it will certainly lead to death. Yes, that's true. Hypertension is, is one of the commonest cause of kidney disease and kidney failures. Cause of, dialysis, kidney transplant, and death. Yeah, that's one. Another one is that you've seen people have stroke before. Yeah, they've just have stroke like that. Hypertension is commonest cause of stroke, but it's not the only cause. That's what will happen if you don't take this drug, especially when the BP is quite high. And you see people, sometimes they will just slump and die. Cardiac arrest, hypertension, or severe hypertension can also cause it. You understand? So when somebody tells you this kind of thing, don't take the drug, because when you start taking it, it means you take it for life, or start putting fear in you of the side effect. Let him also tell the person, okay, tell me what will happen to me if I don't take the drug. And I have just told you, like I always say, the essence of this video is to guide you to make an informed decision on health issues, so that you will live healthy and live better. Okay? So that is the point. And it doesn't just stop there. From the kidney, it will kill the heart, cardiac enlargement, heart failure, to the liver, different organs will be dying gradually. Cardiac arrest, sudden death. All right? So it's good you know this, so that you will make your decision now. That's why I said the essence of this video is not to give medical lecture, but to guide you, to correct some impressions, wrong impression that our people have out there, misconceptions about certain health issues, so that nobody will deceive you again. Yeah, it's true that if you take it, sometimes you take the drug for life. Sometimes it comes with side effect. But if a side effect of erectile weakness that may come after 20 years of taking drug, than you dying of heart attack or having stroke within 1 year or 24 months if you don't take drug and you are having hypertension, which one is better? Even to take the drug for life and for you not to have cardiac arrest, stroke, or kidney, failure within, first 3-5 years, which one is better? So know today that anything you do in life comes with side effect, has consequence, whether good or bad. So it's a silent killer. Once you notice it, let me tell you, it's not everybody that has high blood pressure are on drugs. Some people started with drugs. I have some patients, but now they are not on drugs. We are just monitoring them because the blood pressure has been controlled. You mustn't be on drugs all the days of your life at every point in time. No, it's not true. And there are certain people that has mild high blood pressure that are controlling it with lifestyle, with diet, and exercise. They are not on drugs. Do you understand? There are people that are on drugs, but they are not on daily routine drugs. They are on maybe alternate days. twice or 3 times in a week. So it is left for the doctor to take that decision based on what the blood pressure outcome is. So it is not a generalized statement. So don't allow anybody to deceive you. Please, do not allow anybody deceive you. Take your decision now. If you have high blood pressure and there is family history, even if there is no family history, go and see a doctor. And the doctor will check you and take a decision. And please follow your decision. And most importantly, another misconception I've heard our people say is that I'm on drug. Therefore, because they are on drug, they don't go for checkup. I used to tell people that checkup is more important than taking drug. Because if you don't check, I have seen some of my patients coming down with stroke, yet they're on drug. They have stroke because they are just taking drug blindly without monitoring their blood pressure. Whether the drug they are taking is working for them, they don't know. Whether it will work and the dosage is low, they don't know. Some have been taking drug and the BP drops so low that they start feeling so dizzy and weak because they are not doing checkup. So checkup is a way you can monitor your blood pressure. You can do monitoring personal. You have your own BP apparatus at home, but time to time go to hospital to cross-check. Is very, very important. So it's wrong to say because you are taking drug, that's the only thing that is required of you. No, because medical advice is also important. Diet modification is important. Exercise, depending on the level of the BP, that will determine the exercise. So do well to do checkup. These are some of the, there are so many other misconceptions I've heard about. I've seen people, before you know it, they have stroke, they die. There are so many misconceptions. Now that you know, help me to spread this message by subscribing to my YouTube channel, like this video, share it, and comment on it so that other people will get to know the importance of what we are talking about. You can help to save a life by just subscribing to this YouTube channel, by liking it, by sharing it, by commenting. Send me your opinion, your questions, your advice. I'm here for you. Thank you, and God bless you. See you some other time. It's well. Bye.